So a lot of people have asked the difference between hospice and palliative and what those mean. And my mom, Betty, has been on palliative care. So palliative and hospice both are about comfort and just making people comfortable in the end stages of their life. By the time you get to palliative care, palliative is the step right before hospice. By the time you get to palliative care, us as a family, we have already kind of made the decision that, obviously we're treating things that are treatable, but mom has a terminal illness, which is Alzheimer's. And so you treat things like a urinary tract infection, a respiratory infection, things that are easily treatable, that can improve her quality of life. You treat those things, but she is a past cancer survivor. We're no longer doing scans for the cancer. We're no longer taking action to see if that's come back or anything like that, because those are just kind of things you don't do under palliative care or hospice care. So with the palliative care, that got us a nurse practitioner who visited, I think, about every 9 weeks, and they help act as a liaison between you and your other doctors. They'll help you if you have any difficulty communicating between them or obtaining medications, resources, things like that. The help was fairly minimal. It does not include any aids. It does not include any supplies. It did not include any durable medical equipment. Just basically an assessment. I think they pretty much come and assess to see when you're ready for hospice care. So this week, as my mom was not doing as well as she had been, we did reach out to palliative, and they did elevate her to hospice care. Hospice, again, is about making folks comfortable at the end of their life and dealing with the symptoms and things like that, just to provide comfort and care. And with that, enrolling in that, it's a change for us in that it helps supply a good bit more support than we had. We get a social worker that visits every 2 weeks. We have an RN that visits every week. They can provide us with durable medical equipment. So if we need a bed, if we need a bedside commode, things we've previously purchased out of pocket, we can get those things. We can get the supplies, the Depends, the chuck pads, the gloves, the wipes, that type of personal care stuff. We can get that through hospice. They would send an aide if we needed it. We have our own folks, so we probably don't need to take advantage of that, but they're definitely a little more hands-on support for helping. And so they were able to come in and kind of help assess an infection she had and give us an antibiotic that we needed, and also switch up some of her other meds to keep her less anxious and more calm. And we're already noticing a big difference with that. So that's the difference between palliative and hospice. Hospice is typically done when life expectancy of 6 months or so is expected, but it does not necessarily mean that. There are folks, and even some of our followers have commented that they were on hospice for a long time. If she were to improve to a certain status where she didn't qualify for hospice, they would probably move her back to palliative. But being that's a terminal illness and generally things continue to decline, we probably won't go backwards, but there's no, she's not actively dying at this point any more than she was the previous week. The infection or whatever that she had definitely was a concern, but I don't see it as an immediate threat. Now things change quickly with Alzheimer's, so you never know, but I do feel like we've kind of crossed the hump thanks to the help of hospice, and got us back to where we're a little more normal with my mom.